Hello, guys. Look, I got a new product today. Okay, so this is a water pick. By the way, I'm not making commercials because I don't. I'm not doing it for that. Okay, so I got a new product. That's if you wonder what it is, this is a water floss. Actually, it does two things. It it does it flosses and it brushes your teeth. But the reason I wanted to talk to about that is really about the powerful effect of anti-inflammatory ingredients. Okay, so I'm Dr. Kelly. I am a board certified psychiatrist, neuropsychiatrist, brain health doctor, brain and gut, brain health. Okay, so what I do in my office, I talk to patients, mostly Black women. How do you live a good life by understanding how your brain works? And you know what's important is how your brain, how do you, what do you need to know for your brain to negotiate the new environment that you're in? Meaning that we have changed the way human beings used to live. We don't have the village anymore. We don't we don't have the village the way we used to have it. So reason I'm saying that is because um, so the things that you have to do, especially Black women, because you carry so much on your plate, it can make you feel overwhelmed and stressed out. Knowing that it's nothing that you're doing wrong, it's the brain, your brain that's adapting to a new, fast changing environment. And you need to know the new brain tools so your cortisol level, your stress hormone, doesn't stay chronically elevated, does stay elevated more than 24 hours. Because when that happens, it actually starts killing your organs. And the top 8 chronic illnesses that we're having, especially Black women, meaning that obesity, diabetes, high blood pressure, heart disease, fibroid, autoimmune, lupus, those are gut illnesses. They're all coming from chronic inflammation that comes from chronic stress. So the way to counteract that is to get the new brain tools, meaning that to be able to, as things are going throughout the day, to make sure that you have a kind of sorry, I was disturbed. Okay, so I got distracted. Okay, so I bought a water pick. Okay, I bought a new water pick. The reason why that's important, I had a patient in my office, a guy that came in, and we were talking about the powerful effect on anti-inflammatory food because he has diabetes, he has high blood pressure, he has high cholesterol. And he came to me as a result of different things. But what we talked about is that what are the ways to reverse diabetes? Diabetes can be reversed. High blood pressure can be reversed. Mean that 7 to 8 illnesses that are affecting you, Black women, people in general. High blood pressure, hypertension is the same. Heart disease, fibroid, obesity, autoimmune. They all can be reversed if not greatly reduced by knowing what anti-inflammatory food to eat to decrease. And one of the major things we talked about is that oral hygiene, mouth hygiene, is very important, guys. So it's you can floss with the floss thing, but water floss. I went to my dentist, and I've been using water floss for the past 2 years. So even though when I floss, I still use water floss because the floss cannot get all those things out. Because you know why? Because we know now the bacteria in the mouth, the bacteria in your mouth is closely related to, actually, it increases your risk of dementia, it increases inflammation. So, better ways of decreasing inflammation is by flossing, by using, you can floss and use water floss. Okay. So, I know the weekend is coming in. You have had a lot to do. Make sure that you become intentional, knowing that to get some, to transition your brain from the fight or flight to the rest and digest. Okay. So that's what I wanted to talk to you about. And the series about self doubt, I'm continuing it because the main thing is to realize self doubt is another way the brain sees as um, the same way. Actually, it's a form of stresses. It can be a form of stresses. It's not true. It's a signal. But you can change that perspective by knowing that it's a part of life. You don't have to be perfect. And that way you can empower yourself by knowing your knowing what you have done, the great things you have done to help you to reduce self-doubt by visualizing and also aligning what you need to do with your core values. Okay. So the main thing is really understand the powerful effect of anti-inflammatory. They're anti-inflammatory weight busters. They decrease weight or maintain your weight. They decrease anxiety. They boost your mood and energy. So it's really for you to know to include the top 20 anti-inflammatory food in your diet and know the 8 to 9 supplements that you all should take now, because we have found out that we have microplastics in our blood and tissue organ. If you ask how do we get it? Even the guitar I'm holding, even the brain I'm holding, the the bottle of the water we drank in, they have microplastic that's seeping into them, and they get into our pores, they get into our bloodstream tissue organ, and those things the accumulation of them are what increases the risk of breast cancer, colorectal illnesses are from inflammation. I mean, you cannot totally um, avoid them, but we now know 90% of the illnesses we have can be prevented. More than 90%. I mean, the high blood pressure. So I was talking to this guy. I told him, what do you think I can do to help people? Because it seems like I talk about those things every day. And he says, if you can start matching the medication that I'm taking with what food I need to eat. So cinnamon, turmeric is a very powerful way. And turmeric, by the way, if you take turmeric, I take capsule, and sometimes I do it in food, but I don't like the fact that uh, it can leave the yellow thing in my teeth. But if you have other ways, you can do it. But I take capsule. I take 1,800 to 2,700 a day milligram. I don't take vitamins every day. Okay, I reserve. I take vitamins 4 to 5 days a week. So I said I don't want to be slave to anything. But absolutely, anti-inflammatory leaches out they leach out the microplastics in our blood. They leach out chemicals, metals. So that's the way to thrive. Okay. And there are weight busters. They decrease weight, they maintain your weight, they increase mood, the energy boosters, I mean the vitamin D3 with K2, magnesium, um, probiotic, multivitamin if you're for women, um, vitamin B12, metal B12, vitamin B complex 125. All these great things, guys. If you want in, to live a good life in the 21st century, do most of them or some of them, then they can decrease your anxiety, help you to maintain brain health and gut health, and also make sure you become intentional about eating the top 20 anti-inflammatory food. By the way, chronic pain are decreased. I was just talking to one of my patients. He's actually a veteran. He was a paratrooper, and it was a paratrooper in the 82nd Airborne. So he's had several back surgery. Today he was telling me, he said, "Man, that turmeric stuff is not." I said, "Well, I'm the one telling you. I've used all of them. That's why I tell my patients that I used all of them, and I can tell when depends on what I eat. So as you get older, you have little pain because I play sports. I can tell when I'm going to have pain. Depend now, more so now, depending on what I ate the day before. So those things are totally prevented. Again, I know as women, you worry about your weight, uh, chronic illnesses. It's really to educate yourself about anti-inflammatory ingredients. And by the way, you may not be overweight. You may still have chronic inflammation. It doesn't. So you need to, because a lot of people may uh, not be overweight. They still have heart disease. You still can have high blood pressure. Okay, so I'm gonna leave you and remind yourself the weekend is to do your positive affirmation to know that you deserve to have a place to rest and digest, and be intentional about learning more about anti-inflammatory. And if you want to know more, follow me, join me, and you can get a free Zoom consult. Let me know. You don't have to have pain, meaning that physical, emotional, psychological. It's not true. You don't have to have those things. Okay. Let me see if I was checking to see if my microphone is working. Okay, guys. So I'm writing a paper for to include all the powerful anti-inflammatory ingredients, the top 8 to 9 supplements that you all should take, the top 20 herbs and spices, very important that we all should take, and also a little bit of how to understand how your brain sees stress, things that you have to do to counteract that with anti-inflammatory ingredients, and also how you rewire, how you visualize things to decrease your stress hormone. Okay. So I'll see you until then. I've had to hiccup with this thing. I'm taking off. Bye.